Like numerous professions, the field of nursing has experienced a lot of difficulties during the pandemic. Now, nurses at Rochester General Hospital are planning to unionize. Amel Elhel joins us in the studio with a story on what nurses are hoping to gain from this effort. Amel.
Well, Teresa, from unionizing, the nurses at Rochester General are hoping for better pay, better staffing, and consistent retention. And while their efforts to form are still underway, their parent organization, Rochester Regional Health, is not on board.
Lisa Colombe has been a nurse for 20 years and a nurse at Rochester General for 7.
When I started here about 7 years ago, I worked on a unit and everybody was happy. I was proud of the care that I gave. I could help the other nurses. And that's different now.
Nurses from RGH are citing bad wages, lack of staffing, and low retention as reasons behind their efforts to unionize, something medical ICU nurse Nate Ontivero says has been a long time coming.
Over the last 2 years during the pandemic, we watched a lot of strain be placed on nurses and other frontline workers. And we feel that coming together as a union is a great way to help protect us moving forward and ensure that this is a place as part of a community and a city that we care about where we can provide the best care to our patients.
Jessica Vergara has been a nurse in the surgical ICU for 8 years and a nurse at RGH for 12 years total. She says she has seen the tides turn and it's time nurses have a seat at the table with management.
A lot of the decisions being made directly affect us. So if we don't have a seat at the table, management and the people making those decisions don't actually know exactly how it is going to affect us.
Erin Murphy is a nurse in the emergency department and says along with staffing issues come patient ratio issues.
As nurses, we're the ones on the ground. We know how to make that better. If you pay nurses better, you have more nurses. If you have more nurses, it's safer and more nurses will want to work there. Like, it just kind of snowballs and it feels like nobody's listening to those things.
Rochester Regional Health said in a statement in part, quote, "We strongly believe that a union is not in the best interest of our employees, our patients, or the communities we serve. Although we respect our employees' right to choose whether or not to be represented by a union, it is our position that it is in the best interest of Rochester General Hospital and our employees to maintain direct one-to-one relationships that are free from third-party intervention."
I did reach out to RRH for an interview, but we were provided that statement instead. The group of nurses looking to unionize has not filed for an election to be considered a legitimate union yet. Right now, they are working on getting more support throughout the hospital before doing so. Teresa, back to you.
Okay, thank you, Amel. For background, Rochester does have unionized hospitals. The New York State Nurses Association reports 1199 SEIU represents some strong memorial workers, and CSEA represents some nurses and other healthcare workers at a long-term care facility in our area.